Hi, Dr. Nick Coatsworth here, and welcome to today's Top 3.
What is the advice for caring for older Australians? Are we allowed to visit family in aged care facilities?
A lot of Australians have family in aged care facilities, and we have put visiting restrictions on visiting friends and family, which is going to be difficult during this time. But the reason we've done that is because we know that coronavirus can be very severe in the elderly, and we want to protect our most vulnerable. So, the first thing that's most important is that if you have been a contact or if you're in self-isolation, then you must absolutely, obviously, not go and visit friends and family. If you have a cold, do not go and visit members of your family or friends in aged care facilities. That is a very high risk of transmission. If you have any symptoms whatsoever, please don't go and visit. When you do visit, please only go at two visitors at a time, and please keep your distance if you can. Practice good hand hygiene, and remember that some aged care facilities might actually have additional measures, so you need to call the aged care facility if you don't understand what they might be.
How can I access my medication without going to my pharmacy?
One of the really important things about the COVID-19 epidemic is that we do our best not to let it impact on people with other chronic conditions that aren't COVID-19. So we need to keep our medications going, keep our supply up. You can get your medications delivered by your pharmacy, and most pharmacies are doing exactly that to enable you to maintain isolation at home and decrease contact with other people. Get a good supply of your medications, but don't hoard them. Don't hoard them, because there are no shortages of concern at the moment. And please, keep taking your usual medications at this time.
What are the symptoms of coronavirus? There is information circulating that loss of smell and taste may be the first symptoms.
So the common symptoms of coronavirus are those of a respiratory tract infection. So you could get a cough, a sore throat, a runny nose, fever as well, and that might progress to severe shortness of breath, in which case we need to get you to hospital. But it can also be very mild symptoms, and some people have reported not even feeling unwell at all, the so-called asymptomatic carriers of COVID-19. This idea that there's smell and taste issues with COVID, I have heard about that. That can obviously happen with other respiratory infections as well, so it's not a good way to discriminate whether you might have COVID or not. At this point in time, if you have any symptoms of a cold, you have to assume that it might be COVID, as mild as it is, and really isolate yourself from anyone else. And remembering that if this is a chess game and COVID's on the other side, it's got one move and one move only. It's got to get from you to someone else. And if you keep your distance, 1.5 metres or more, if you're washing your hands, if we're not touching our face, and if we're staying at home, we will stop this virus winning that game. So thanks very much, ladies and gentlemen. That was my phone beeping. My apologies for that, but I'll see you again tomorrow for Nick's Top 3.